Hi, and welcome to the first episode series of Therapy for You. Today we are interviewing my neighbor and my mentor, the lovely Dr. Marietta Collins. And she is a licensed clinical psychologist, and today she's going to talk to us about mental health. So, Dr. Collins, can you say a few things about yourself?
Sure. First, thank you so much, Imani, for inviting me to come to the New School and talk to you and your peers about mental health. As a licensed clinical psychologist, I do a variety of things. I'm on faculty at Morehouse School of Medicine as a director of behavioral medicine. Prior to that, I was on faculty at Emory University School of Medicine as a director of behavioral health. As a psychologist, I provide mental health and therapy services to adults, children, and families, as well as couples. I also have been involved in research projects, and one of the latest things that I've done is to write a children's book.
Great, yeah. It's a really good book. Okay, so thank you for coming. And so I'm gonna ask you a couple of questions that the students here at the New School want to know about mental health. So
Sure.
let's get started. What are some myths about mental illness and mental health?
Certainly there are all kinds of myths about mental illness. One of which is that sometimes people have said that you get mental illness from your parents, or that mental illness is a result of poor or bad parenting. That's just not true. Certainly there is both a genetic and an environmental contribution to mental illness, okay? But there are lots of people who develop mental illness who, if they were to trace into their family background, it doesn't seem as though they have them. But basically, mental illness is like many medical illnesses, in that you can have a predisposition to it. Okay, let's say a gene for it, and that gene can or cannot be activated depending upon the environment that you live in. So sometimes, so it's certainly not a personal weakness. It's something that develops over time, or can or cannot develop, should I say. One of the other things about mental illness, sometimes people say that's not true, is that people are faking mental illness. When people are sad or depressed, it's that you're faking it. Certainly there's a difference between being sad and being depressed. In order to, I guess, meet the criteria for being depressed, you have to have certain symptoms. When you're sad, you're just going to be sad for a day or two, but if you are depressed, you're sad for a much longer period of time. So certainly you can, in fact, tell the difference between mental illness that someone has for a sustained period of time versus one that people sometimes just may feel sad about.
Thank you. Yeah. So speaking of depression, what is the best way to handle depression?
Well, let me differentiate again, if I wasn't clear before, between depression and just being sad. Depression, again, is a diagnosable mental illness, and there are certain criteria. It has to exist, it has to have lasted, for more than, let's say, a day or so. That's one of the criteria. It's prolonged sadness for, let's say, 4 weeks or more, okay? And if it doesn't seem to go away, what you should do is seek treatment for it. And the kinds of treatments that they have for mental illness include going to see a psychiatrist, which is a medical doctor, okay? Or you can go see a therapist, or you can come and see a psychologist. What our research has established is the most effective treatment for depression is a combination of therapy and medication. So, if in fact somebody does meet that criteria for depression and they're not just sad, then I would suggest that they be evaluated by a professional and the treatment be planned according to the degree of the mental illness or depression.
Okay, thank you.